Welcome to the Autoimmune Campfire.
Join us, coaches Helen and Nona, for honest, heartfelt conversations around living well with a chronic condition.
Come sit at our campfire. There's a chair waiting for you. Hey, Helen.
Hey, Nona, how are you today?
I'm so good. I cannot even believe that this is episode 8.
Right?
Yeah. I mean, it has gone so fast. So I just can't believe that here we are, episode 8. And today we are going to be talking all about sleep, all about sleep. But before we dive into that, how was your weekend at the beach?
Ah, weekend at the beach was absolutely fabulous. I love the autumn colors. I love the sand in my toes, my feet in the ocean. We had a wonderful time with our friends who are my husband's best friend from grade school. So we're talking 50 plus years of friendship, and his delightful wife. And we had an absolutely lovely time. So, yeah, how about your weekend? Because I heard there was a lovely young lady.
Yes, I got to see Clara. She came home for 24 hours and it was great. You know, she comes home for haircuts, as we do. As we do as women, once you find a hairdresser, you travel for miles to see your hairdresser. At least for me, like I would come home from Zambia once a year and get my hair cut. Like, of course, there was nowhere to get my hair cut in Zambia. So there was that. But um, it was absolutely lovely to see her. I will also say that this period of time, just to name it and own it, I have my MRI this week, my 6-month MRI. I've had my blood work and I'm seeing my neurologist. And I will definitely say, like, that is always a time where there's just anxiety sort of playing over on the sideline, like, "Oh, what if? Is everything okay? Da, da, da." So I just wanna say that out loud because I'm sure I'm not alone in the follow-up anxiety.
Mhm.
So
I hear you. I hear you. And I hear you and I see you. And as a very wise soul would say to me, and I'm breathing with you when I was going through the worst of mine, my moments, my little, yeah, my moments in this. Yes.
for sure, for sure. Well, thank you. Whew, I appreciate it. I really do. So, do you wanna start us off, but with the fantastic quote that you found about sleep from David White, which I just love, 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 love.
I know. I need to call out my dear friend Imogen, who I walked with yesterday, who's an Alexander teacher, and she said, I love this quote." And she said it to me, and I was like, "Oh, must put that in." So I'm giving her a little wink. Um, so here it is. To rest is not self-indulgent. To rest is to prepare to give the best of ourselves. And that's by David White. And I want to sort of, when I typed it out, I was thinking to myself this morning, it's, to give the best of ourselves, not just to others, but please to ourselves, right? All of it, right? Let's not just be like, let's just fuel up so we can do more out there.
Oh my gosh, right? Well, and I love that. I think that is such a beautiful quote, and it also really ties back to so when we were talking about pleasure and restoration, like, rest is part of that, but sleep is such a big part of restoration and self-restoration that we really thought it needed its own episode. Um, yeah, because it is so important and it's honestly it's so problematic for the general population, and even more so for folks who have autoimmune conditions.
Absolutely. Yeah, absolutely. And it's one of those things that I think we talked about this previously. If doctors wrote a prescription for drink more water or get a full night's sleep, we could we could be doing amazing things on this planet, especially I would say in Western culture, where we have when it gets dark, we put the lights on and we just keep going instead of actually what is it that we need to rest our sweet bodies.
Absolutely. Absolutely. Um, so where do you wanna start? Like, I know that we had a very, like, kind of all over the place conversation to prepare for this conversation, and I'm like, "Where do you wanna start, Helen?" I mean, I feel like this is such a big topic, so I'm gonna let you really decide where we start this conversation.
So, I'm wondering, you already sort of hat tip to it, which is before we dive into what this means if you have an autoimmune condition, what about if we look at the perspective of your non or your entire population, right? So 20 to 40% of people in the Western population have insomnia. Up to 15% of those qualify for a clinical diagnosis of insomnia. And then, we talked about this in when we meet to talk about this, but common pharmacological interventions don't necessarily work well in the long run, and they have significant side effects. So we sort of wanted to say this is not just for autoimmunities. This is also something that we recognize is key in the general population. And I loved learning from you, Nona, from your research when you were doing your Harvard Masters. But let's go back and talk about, what's the data then for MS, right? If you think about MS and sleep disturbance.
Right. So I follow this other gentleman who's on Substack. His name is, well, his the name of his Substack is MS Selfie, which is kind of an interesting name. But he actually did, and he's a neurologist who specializes in MS in the UK, which, they have a little bit of a different system when it comes to treatment of MS and all of that. But he did a poll of his patients and people with MS and found, and I want to make sure I get this right, but what he found when people were talking about sleep is that 60% of people who were polled in this MS study say they sleep reasonably well to poor. Like, so that's, like, not that great. 60%, right? Like, that's not good. And so only 33% were good or very good or excellent. That's not great. So the issues for people with MS, and I know there's some overlap with RA and probably other autoimmune conditions too when it comes to sleep, but the problems that wake people up or keep them awake are pain, which I know is an issue with RA, restless legs, menopausal symptoms. I also have drinking and daytime napping on this list, and I don't think that is what it is. I don't think that's true. So that's actually really funny. I don't that's not a related those aren't related issues, I don't think. I don't I'm not sure.
Well, it's interesting because I was looking up and just trying to do a little bit of looking for numbers on RA, and I found one article that said 25 to 40% of patients with RA have sleep disturbances. And and that they say are related to RA. So that's pain, inflammation, and insomnia. But then there was, I saw also alcohol use really impacts, well, we know it impacts our sleep, whether you have autoimmune condition or not. So I do think that that can make a difference. And also late napping, what we know from the research from Matthew Walker's book that we're going to reference today. And I think that, so that's helpful to know. Then I've also, in some of these resources, they said up to 80% people with RA have a sleep disturbance. And that was whether you actually are, actively flaring or not. So I thought that was really interesting. It doesn't surprise me considering what you deal with on a day-to-day basis, right? Joint pain or discomfort and movement. Every time you turn over, you might, feel something and that might wake you up. But I thought what was really interesting in what I was looking at, if you're more rested, your perception of pain is less. So it was like this flip side of, wow, we can get woken up because of pain, but if we're more rested, we have less pain. So there's really that invitation to do what we can to get the sleep that we can, but not get anxious about it.
Absolutely. Well, and since pain is kind of a common denominator, pain, insomnia, for people with MS, also restless legs, but that's kind of a form of pain, and bladder issues. Like those are all like they're all kind of pain related. And what you're saying, like when we look at the most current pain science, right, the more rested you are, the more regulated your nervous system is, which means that you would have a different perception of pain. You would experience it differently in the body. So, I think knowing all of that, insomnia, sleep issues are not only something that autoimmunities, which I've never heard that. It's
I
cute.
don't know if it's a word. I think I just
Well, we're going to make it a word. Autoimmunities suffer with sleep stuff, but that's not unique to the autoimmune population, right? Like many, many people suffer with sleep disturbances. Let's say that. And including us, right? Well, not so much you, but I certainly have. So I would love to hear more about your experience with sleep, and then I'll share mine, and then we can talk. We can keep talking.
I have been a good sleeper right from the get-go. In fact, I heard that I was a very easy baby. I just slept and ate, and it was just very easy. What I learned when I first was diagnosed and I went to a somatic therapist to see if it would help me to get back in my body when it was so jangled. And she said to me that between the hours of 10 p.m. and 2 a.m. are your maximum healing time. So ideally try and be asleep by 10 p.m. And I would say when I am interrupted with sleep, so for instance, we were staying at this lovely VRBO and the smoke detector went off at, the where the battery's going, beep, beep, at 6 a.m. on Sunday morning. And so like my sleep was a little bit kind of truncated. I noticed that immediately impacts my well-being. So here are the things that for me, sleep, I ideally want to be in bed by 10. I would love to go earlier if I could, if I make time for it, which, is also an elegant choice. What I would say is when we got our puppy during the pandemic, she was sleeping in a crate, but then she moved into my daughter's bed. And then when my daughter went to college, guess whose bed she is in now? So I know, we have a little fluffernutter in the bed, and that is not ideal for sleep. So, work in progress. The other thing is, I think I'm more of a late sleeper. So, my husband, who is very strong and very athletic, likes to do pirouettes to turn in bed instead of just gently shifting from side to side. So the covers go, the bed bounces, so that's also, we're looking into sort of split cover solutions to see. So I think that the thing is, it's all about these little pivots that we make to help us sleep, right? Instead of, you know, giving up on it. But what I would say is at the beginning, when I was first diagnosed, I literally felt like I had glass in so many of my joints. I couldn't even bear the weight of a sheet on me. It was so brutally painful. Whereas now I actually find the sleep benefit of a weighted blanket. And that's probably because I'm so much more stabilized. But I would just say that, it was absolutely excruciating and really hard to sleep. And I think that just got me into a vicious cycle. So once I was more stabilized, I could sleep more. Then I feel like I got better faster. So anyway, also there were other things like great medicines, great complementary and supportive therapies, but definitely prioritizing sleep is key to me. So, Nona, what about you?
Oh my goodness. Well, I have really never been a good sleeper. I've only been a good sleeper probably in the last 15 years, maybe not even that long. I had night terrors from the time I was 6 until I was about 39, to the point where like my I would wake my husband up like because I'd be screaming or I'd be like in the middle of like a nightmare of some kind that I would wake up. I'd walk around the house. I slept walk. Like it was honestly like terrible. And then I know this is going to sound completely off the rails, but I was having some energy work done when I think Clara was 4, so it's been like 16 years. And I had some energy work done, and I didn't say anything about the sleep. And when she did this piece of energy work, which was kind of magical that this happened, my night terrors went away. And I was like, well, that's weird. I mean, like, I'm not expecting that. So I have actually not had well, I've had a couple, but nothing like they used to be at all. So even after I didn't have the night terrors anymore, I didn't sleep particularly well. I'm a very light sleeper. So everything wakes me up. And so when my husband was in, where was he? Afghanistan, I really was like, this is the year I am going to become a good sleeper. And I started going to bed when my daughter went to bed at 8. And I would get off my phone. I would start winding down. I would read a book. I'm a reader. I know good sleep hygiene says not to read in bed, to do nothing but sleep and sex in bed. Like that's kind of the if, like that's it. You sleep and you have sex. Um I've read in bed since I was a child, so for me it's very comforting. And so but I started going to bed when she went to bed. And I started taking melatonin. I started taking other herbs like valerian. I take Amy Meyer's Rest and Restore. I just started really being committed to that. And if I'd wake up in the middle of the night instead of getting up, I would do breath work or I'd do a yoga nidra or I'd just lay there with my eyes closed. And instead of freaking out that I wasn't sleeping, I'd be like, well, it's okay. I'm getting rest. Like I'd really focus on not getting anxious about the fact that I wasn't sleeping because that makes it more likely that I will not sleep. So I really focused on that kind of approach to my sleep. And now I would say I'm a pretty good sleeper. Now I do sleep with earplugs because my husband's a snorer. We have a bed that doesn't really move. It's like a Tempur-Pedic style bed. So I don't feel him moving when he moves at night or gets up, and I have earplugs, and I still do the same thing. I go to bed. I'm usually asleep by 9 or 9:30. And because if I am up at 10, I get a second wave of energy, and then it's really hard for me to go to sleep in that time after that time. So I am I mean, my family would probably say I'm pretty militant about sleep. I'm like, "No, everybody needs to get enough sleep." Like, this isn't optional. Like, when Clara was in school, in high school, I was like, you need to sleep. Like, you have to go to bed because it's so critical, particularly for teenagers who tend to get less sleep, and they need more sleep according to the research. So, I am very passionate about enough sleep. And it's funny because when I was in that master's program and I was in this class, sleep and mental health, they were talking about like, you know what, researchers really want to figure out why we need to sleep because they'd like to figure out how we could just get rid of it. Because it's counterproductive, literally. Like sleep, like they're like, why? This is useless. This is lost time. And I'm like, what?
Yeah, and yet we're the only animals that consciously deprive ourselves of sleep. And to what cost?
Yeah, what's the cost? What's the cost? Absolutely. So that's my very long and sordid, like, sleep story.
Your body is whispering secrets to you about the life you're here to live. Decode the messages about the joy you're meant to experience despite, or maybe because of, the condition that upended everything you thought you knew. If you're ready to make magic and meaning of your one wild and precious life, learn more about coaching with Nona at nonajordan.com. I love it. It really made me think when about how could I get to bed a little bit sooner, because I have that second wind as well. And I just love your self-awareness that if I don't go to sleep at this point, then I get a second wind and it's much harder to get to sleep.
Yeah, totally.
Absolutely. Because one of the things we were talking about that was is just such a powerful resource and good solid science is Matthew Walker's book, Why We Sleep. I'm just going to flash it up here. So good. We'll put the link. We'll put the link in the show notes. But basically, he's a professor in neuroscience and psychology and is the director of UC Berkeley's Center for Human Science. He has a great TED Talk. We'll put that link in too. And fun fact, when I was revisiting this stuff preparing, he got his PhD at the same university as I got my PhD. I'm
So
like,
obviously he's
maybe
amazing.
2 years apart. I'm like, damn it, I could have met him. He's fabulous. Anyway, he explains what happens when we neglect sleep and how it impacts our health, our creativity, our problem solving, our decision making, our learning, our memory, and our lifespan.
Mhm,
And it's basically he gives this warning of the decimation of sleep throughout industrialized nations is having a catastrophic impact.
mhm,
He also talks about the impact on the immune system and how, I mean, there was in his TED talk, he talks about how killer cells, even after one night of 4 hours of sleep, are decreased. So these are the things that often take out cancers, early cancers, things like this. So I mean, there's that link to immune system and cancer and all the things, right? And he's even linking it to Alzheimer's, although I don't know how solid that research is now, but I definitely can see how that happens because one of the things when I was learning this earlier, when it first came out, was it's almost like our brain has a wash cycle. It's like all of the chemicals that build up during the day, it has this sort of wash and rinse cycle that happens in those magic hours we've been talking about. And if we don't get it, those chemicals just kind of stay and they can have an impact. So I've heard that the brain is busier during the night than it is even during the day, which would sort of make more sense. It's doing its recovery. So why would we want to stop that? Is that
right. And, as you're talking about that, I could also imagine somebody who struggles with insomnia feeling even more anxious about their sleep listening to this, right? And that's why, oh my gosh, if the drugs for helping us sleep don't work, then what do we do, right? Like how do we help ourselves sleep better, which helps our immune system, helps our health and well-being, helps our perception of pain. Like there are so many reasons to really focus on getting a good night's sleep. There are lots of things we can do. There's lots of information about sleep hygiene programs, but one of the things I'm going to go ahead and talk about the meditation and sleep. So, one of the things that I was looking at when I was in this class, which we did read that book, honestly. Our professor recommended that book because he was like, "This is a fantastic book." But one of the things that I was looking at is what is the impact of meditation on sleep? And sleep can have a meditation can have a really positive impact on our sleep, and they are still trying to like suss out why. Like they have some theories about why it's helpful for sleep, but having a meditation practice that's regular and consistent can actually help to increase and make your sleep deeper and better. And there are various reasons why they think, but it's all theory at this point. So it's worthwhile to run the experiment yourself, as we keep saying. Like, try it yourself. I mean, the thing about meditation is it does take some time, right, to figure out your rhythm and flow, and you kind of have to do it consistently for it to have that kind of impact.
can you talk to us about yoga nidra? Because I absolutely love the yoga nidras you do, and they really do contribute to my relaxation and sleep.
Oh my gosh. I love yoga nidra. I've been teaching it for a number of years along with breath work. And one, it has been studied and shown to and this is I'll get to the sleep part, but it's been studied and shown to actually help people with post-traumatic stress disorder, like be able to relax and like help them heal. And a big piece of PTSD is also they can't sleep, right? Because they have flashbacks, and it's very challenging. And so yoga nidra is nice because it's a guided visualization type of meditation that focuses on moving through different layers of the body. And it can be used right before sleep. And it's really effective to help people go to sleep, but it's also a lovely daytime morning meditation. When I was doing all these trainings, I was doing yoga nidra every morning, and I really did sleep a lot better during
Mhm.
that time. But there are a couple of things that happen, like it helps with, well, they don't really understand why yoga nidra helps with sleep either, right? But it can really lead to so much relaxation and mental stilling of the mind that it helps people fall asleep and stay asleep. So
Mhm.
there are lots of guided yoga nidras on like Insight Timer. We are going to put a link to one that I did, a short one, in the show notes as well. So you can try that out if you'd like to try it out.
Please do. It's so good.
I really do. I love yoga nidra. I think it's such a powerful meditation practice in particular because with mindfulness, like a lot of people will say, well, I'm not a good meditator because when they sit down and they're quiet, their mind just starts like going all over the place. But the thing about yoga nidra, it gives you a place for your mind to rest. Like you do not have to sit there in just the silence, which honestly, for people who have any kind of like high anxiety or post traumatic stress, sitting in just silent meditation can can not it's not indicated like usually. So yoga nidra is a really nice way to go.
I agree.
Shall we talk about learnings?
Yeah, let's talk about learnings. Do you want to start or shall I start?
I'll start this week. I think, yeah, why not? So I've mentioned this and we've kind of talked about it, sleep hygiene, right? Being honest with yourself, and getting serious about your sleep, right? Like if you don't sleep well, or if you like to stay up late, or like really being honest, like what kind of routine can you create that will support good sleep or better sleep even, because sleep is such a healing time for our brains and our bodies. It's essential, especially if you're an autoimmune. I'm going to use that word now all the time. And again, as Helen was saying, like the hours between 10 and 2 are your friend when it comes to getting the best benefit from your sleep. Yeah. So I will also say that when you are sleeping, it helps memory consolidation. Like Helen was saying, like the wash cycle, like it just cleans things out to leave a fresh, clean slate, in the morning, and gets rid of so much flotsam and jetsam. That's my official term for that. Flotsam and jetsam.
I love that. I love that. So it's really giving your brain the best that it can
Yeah, your brain and your body.
and your body. Yes. Yes, absolutely. So number 2 is so much can impact your sleep, right? So look back on your day. If you're not sleeping well, maybe look back on your day and say, how do I set myself up intentionally for sleep? Like what happened that day, right? Did I watch TV, violent TV, and drink a cup of caffeinated coffee like right before bed? I mean, did I eat really late? Did I exercise right before bed? I mean, there are some great practices in Why We Sleep, or even if you watch the TED Talk, that kind of can really help you set up for the best kind of sleep. But looking back, right, if I exercise closer to bed, it sort of vamps my system up a little bit. And so it's harder for me to get to sleep. So I tend to exercise in the morning. I also don't watch any violent TV anymore. I mean, even if I like a certain show, but if it's too violent, it stays with me and that just doesn't help me go to sleep. I need some levity, so I might watch something funny. Exercise helps us sleep. Do you have exercise built in every day? All right, so different pieces. And one of the things that we didn't talk about was magnesium. As you know, obviously you talk to your doctor, but magnesium as a supplement at night has helped me immensely. So sort of build your habits around and notice without judgment. There's no point in taking a big stick and beating yourself up, right? Who wins? You're beating yourself. Who wins? Nobody. Just start to notice and see which little mini pivots you can make.
Mhm. Mhm. Yeah, I always love it when you say mini pivots because 'cause I'm like, "Change everything so you can sleep. Change everything so you can prioritize pleasure. Change it all, okay?" Like, that's but that's
I love that. Yes, yes. And I find that, when you think about it, certainly with RA, anxiety and depression are much higher. And so if you're really anxious, the thought of changing everything can be, so it's like, what's the one thing? What's the one tiny thing? Like, what's the baby step, the turtle step that I can make? And yeah, I'm with you. If we can change it all to give ourselves a sleep, we're going to benefit on the flip side.
right, right. And I think to what you said about, how you have your day, like, your best day starts with a good night's sleep, and your good night's sleep is supported by how you move through your day. Like, it really is it's just that important. It's all
It really
yeah,
is.
it's that important, and especially if you have an autoimmune condition, your sleep takes on even more importance. As we know, fatigue is a real issue for folks who have autoimmune conditions, and I wonder how much of that is because people with autoimmune conditions don't sleep well.
I mean, yeah, I wonder.
I'm not sure. Okay, let's see. Okay, and then, we also kinda talked about this too, right? Like, I know my husband, when he wakes up at night, he gets super anxious, and we've had lots of talks about this, like, his mind will start spinning with work stuff or whatever, and I'm like, "If you just lay there with your eyes closed and you breathe, you're still getting rest." It might not be as good as sleep, but it is rest. It is you letting your body restore, okay? So, take care of yourself when you get up at night. Like, I am a big fan of laying there and doing breath or doing a yoga nidra or just like, "Hey, it's gonna be okay." Like, really talking myself off the ledge of anxiety when I don't look at my phone. I don't do any of that. I'm just like, "Yep, this is my time to rest and be in bed and eyes closed." That's what I'm doing. So, and I know that's different for you. So I want you to talk about what you do too, because I think there's real validity to that because I think this is actually in that book. Like, he talks about this, right? So, I mean, I, again, you have to run the experiment that works for you. But Helen, what do you do?
If I can't sleep and I feel myself getting frustrated, the first thing I do is, and I already mentioned Imogen, who does the Alexander technique. She taught me this technique where I just lie there and I say, I'm free to notice ease. I'm free to notice ease. And it's amazing. Like, immediately, I'm not trying to force myself, but it's like my body releases. Sometimes, the self compassion, I'll put a hand on my heart or on my face or on my belly, to kind of remind myself. Or she teaches the cycle where you say it as you touch each digit. And I'll put a link below if you're interested in that. I also, if I really can't sleep, and I tell myself I'm resting my body, I'm resting my body. So I make it really clear. And that seems to help me with the anxiety that happens with, oh my goodness, I've got to get up at this time and I've got all these things and I want to be sharp and all the things that start. But if I really can't sleep, from the book, he says, get up and read so that you're teaching your brain that when you're in bed, it's for sleep, or as you said, sleep or sex, right? So so I get my blanket and I'll go and I'll sit in, we have a comfy seat in our bathroom, and I'll kind of wrap myself in the blanket and I'll take a book, not my phone.
No, not the
Not
phone.
that, never that, as my son would say. Get my book and just sit with it sort of really dimmed light, and I read until I feel sleepy. As soon as I feel sleepy, I get right back into bed. And so I think that's a brain training technique. So you don't just, your bed doesn't become the place that your mind is spinning and your brain's like, I'm in my bed, so let me get busy. So I think that that's really helpful.
Again, we're going to put a bunch of links in the show notes for you so you can explore. But again, I think really it's always about running the experiment that works for you, but also like I think what I would want people to take away from this is that, you deserve to have good sleep. And when you have good sleep, it supports your body and it supports your health and it's going to help you heal and feel better and live your best life with an autoimmune condition or even not. Like even if, even if you're like a normal person who's not an autoimmune, which now who does not want to be an autoimmune? Seriously.
Also, a lot of the leaders who I work with, when things are hectic, the first thing that goes off is exercise and sleep. And what you could argue is those might be the most important coping strategies as you move forward. So it's not just for people with autoimmune. It goes back to our episode on pacing. It goes back to pleasure. I mean, so please take care of this human that is you, no matter what condition you're dealing with. It's really important.
Right. Even if you don't have a condition, even if the condition is just being human.
It's just living. Yeah. Which is its own condition.
It's its
And,
own condition. That's right.
and the other thing I'd like to close with is thank you so much to all the listeners who are reaching out to us. We really appreciate it. And if you are enjoying this, please go on to Substack and put a comment. We love to hear from you. We want to learn from you and hear from you, but also rate us, whether on your podcast of choice.
Yeah. Whether you listen on Apple or Spotify, we would love, 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 love to see your ratings on our podcast. And we just so appreciate you being here. So join us at the campfire. And Helen, it was lovely to see you. And we'll see you next week.
See you next week. All right. Bye-bye.
Did you enjoy this campfire conversation? Please rate our podcast wherever you're listening to light the way for others to find the Autoimmune Campfire. The information provided on the Autoimmune Campfire is for educational or informational purposes only. It is not intended nor implied as a substitute for professional medical advice, diagnosis, or treatment. Always, always consult your physician or other qualified healthcare provider with any questions you might have regarding a medical condition or treatment plan. The Autoimmune Campfire does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on this site or podcast. Recording and editing wizardry by Make Your Day Richer. Thanks for joining Helen and I around the campfire.